record this and go ahead and get started. Again, thank you for being here. And I'm going to turn over to D. Jamison, our Assistant Superintendent of Instruction, for the presentation.
Okay, well, thank you. And again, thank you for all of you who are here for this chat so that we can share some of the work that we've been doing here in the district. This is an overview of the Learning Continuity and Attendance Plan, and we've been sharing with various parent groups in terms of the work that we've been doing. This plan has several different components, and it is replacing our LCAP that you typically would have heard about in the spring of the year. We did do some stakeholder engagement work on that. And instead of having the full 3-year LCAP, we've been asked by the state to instead create this 1-year learning continuity and attendance plan in response to the COVID pandemic. So we will be addressing in this plan stakeholder engagement, our in-person instructional offerings, our distance learning program, learning loss. A huge focus of the year is the recognition that students in March, schools were closed, and that we have to have a deep awareness of what students' needs are as they begin to come back to this school year. We also will be addressing in the plan mental health and social emotional well-being, professional development for our teachers and resources to address trauma based on the effects of COVID, and pupil engagement and outreach, including procedures for re-engagement when students are not attending school or are not completing work. We also have a section in the plan on school nutrition. And then we have specific actions like we did in the LCAP that addressed increased or improved services for student groups such as English learners, foster youth, and socioeconomically disadvantaged students. So these are all the plan components as the state has laid out this report. So in terms of what actions we're proposing, with our in-person and distance learning programs, you may be aware, I'm sure you are, that we did purchase digital curriculum to ensure continuity of learning. So the board did approve digital curriculums in science and social studies, in art. And so we are currently continuing to work with our IT team to get all of that up and running for everyone. But this ensures that continuity of similar curriculum offerings between students who ultimately would return to school in the hybrid model and the distance or digital academies. We've also proposed all of the personal protective equipment and safety protocols for in-person learning or any time that students return to school. We also are proposing that we specifically hold both student and parent listening sessions to augment site activities such as coffee with the principal or the superintendent's chat, specifically trying to have ongoing feedback around distance learning, digital learning, and hybrid offerings. And then we also have proposed superintendent surveys for ongoing feedback. In terms of learning loss, and we've implemented this already, we've had baseline assessments for all of our students. Our teachers are focusing in on the most essential standards and those taught during the 3rd trimester. And so our instructional coaches had provided guidance documents to all of our teachers, which focused in on the standards that were taught. Teachers met in vertical articulation teams to take a look at what students needed to absolutely come into their new grade level with, and then they did assess to determine how students were doing. Student need will be initially met through teacher win time, which is what I need time, or RTI team. Different schools call it different things, but it is that extra time and support built in within the school day. And then we're also proposing specific learning opportunities such as small group or individualized tutoring in an extended school type setting. In terms of mental health and social emotional learning, we have hired an additional 3 counselors. So we do have full-time counselors now at all 10 sites. And in terms of the opening of the school day, teachers are engaging in a whole class check-in. So in addition, around professional development and the trauma resources, Student Support Services has a universal social emotional screener that would be made available with parent permission for all students. This would help to inform the work of the counselors in their groups that they make, their counseling groups. It's also the focus of our PBIS program on all of our campuses. We are focused on social emotional needs of our students and staff through PBIS this year, along with trauma-informed practices. And then we'll be moving in after the first of the year into equity trainings for our teachers. In terms of pupil engagement and outreach, we have an attendance and engagement plan based on the legislation. We've established attendance outreach teams at all of our schools to help in a situation if students, as I said, are not attending school or they're not completing their work. It's really focused on a problem-solving collaborative effort so that we can help remove barriers to ensure that all students are both attending class and engaged and able to complete their work. Just this week, we are now able to serve lunches for all of our students through December 31st. Prior to that, we were still working through students with their numbers and picking up their lunches that way. But we have in our nutrition section information about how all students ages up through 18, I believe, are eligible now to collect their lunches. And then we do have our services that we previously had in our LCAP around English learners, such as our EL Collaborative, our EL coaches, our actions around our foster youth, our CARES portal, and other things that we had previously in our LCAP, and we're including those then as they roll forward into this year, into this plan. So that's what we're doing at this point, and we just wanted to give you an overview and an opportunity if you had questions or ideas as you heard about any of these topics, to give you that opportunity. And I'll stop sharing.
So any questions? I mean, the great thing about hopefully what you're hearing is there is a lot of continuity in terms of programming that the district has been doing, with expansion and a real focus on the social emotional piece, in the fact that we've added full-time counselors now at every single school site. They were often shared before, and that was challenging, but in this new environment that we are in, we had already heard from our stakeholders that counseling was a priority when we, through LCAP stakeholder feedback, the health and safety survey feedback, that was a definite #1 priority. And so we have been able to put that into action. And so there's a connection. It really is important for us that this isn't a checking off of boxes to be in compliance. It's around authentic work that we do as a district to ensure that our kids are both supported academically, but also social emotionally. So I don't know, questions that you might have or things connected to this. As Dee mentioned, we'll be bringing this to the board for an open feedback on the 15th, right, I believe, Dee, and then on the 29th, and then the 29th for formal approval, and then it has to go through the county as well. Tight timeline, though. We didn't get this until August 1st, which is different. Normally, we have 6 months to write the LCAP or more. This has been a very short 6-week turnaround from the time that Dee got this to where we are at, well, about a month turnaround right now since the time we actually got our sneak peek at what was going to be required in this plan. Questions? Okay. This is our good teacher wait time. We're giving you the opportunity to think about questions that you might have for us. Or anything you're excited about.
Mike, I have a question, and I guess mine's regarding the announcement today by LA County that those receiving IEPs and other specialized services, including EL students, can resume in-person instruction on September 14th. How does that weigh into New Hall's plans as you just explained, as somebody with a kid who's in special needs, providing the continuity and the potential of flip-flopping between you can be on campus and then in 2 months maybe they can't. Like how do you balance that as a district?
It's a great question, and my presentation next is going to lead right into that, Stacy, around what we discussed last night at the board meeting. Great question.
Mhm.
Anything else connected though to learning continuity plan? Are we ready to move forward with our next piece? Okay, so thank you, Dee, for providing that overview for us. We appreciate it. Let me see here. Can you all see my screen now? Hopefully. So we're going to give you an update in terms of the work that's been going on around COVID, other things, and then the new state guidelines, and then hot off the press is the county guidelines. So probably many of you heard last Friday afternoon about this new tiered system that came out from the governor. It's now a color coding system that goes from tier 1 to tier 4. You don't want to be in tier 1. That's I guess the most restrictive tier. It's where the counties that were on the prior monitoring list will fall as this is launched, and you're working towards tier 4. There's some interesting adjustments though in this process, in the fact that they are just looking at 2 different indicators, one around the new cases per 100,000 and the other on the positivity rate. And again, those are over 7-day averages. And what they are pulling out though from counties are cases that are connected to state and federal inmate cases. So they're pulling that data out so it's not skewed as well. So that's the latest that came out on Friday. LA County would, of course, because it was on the monitoring list, fall into that tier 1 category. So some of the rules for this framework, first of all, the first, I guess, report of this will come out on September 8th. That's where they'll place each of the counties into one of those different tiers. As a county, you will remain in that tier for 3 weeks in order to be able to advance to a different tier, either up or down. You can move forward from one tier, only one tier at a time, regardless of what your metrics actually show. If your county's case rate and your positivity rate fall into 2 different, so let's say, I'm going to scroll back here. So let's say your positivity rate was in the red, but your cases rate is in the purple, you automatically fall into the more restrictive. So no matter where you're at, you're going to always fall into that more restrictive one. And then they're going to start giving more information around local health jurisdictions. That's a new thing that will be coming out as well. So in order to advance out of a category, it must have been in their current tier for a minimum of 3 weeks. That's because of the initial launch of this information on the 28th. So you will get our first reading on the 8th of September. And then a county must meet criteria for the next tier for both measures for the prior 2 consecutive weeks in order to progress out. So if you think about it, if we're in tier 1, the purple, in order for that would be 3 weeks, and then 2 more weeks out in the other. So you're looking at about 5 weeks to be able to shift out of that category to get into the next one. The state's going to establish some equity measures looking at a variety of things from access to contact tracing. A bunch of different things are included here. And then in terms of moving back, so let's say a county was in the orange tier, there are ways that would, or things that would trigger them to go back. So if they have, during that weekly assessment, if a county's adjusted case rate or test positivity rate has been within the more restrictive rate for 2 consecutive weeks, then you bump back. So it takes 2 weeks to be there. Anytime the state or county public health officials, they can work together to determine targeted interventions or the countywide modifications that are necessary to address impacted like hospital capacity or disease transmission as needed. This is a big picture, not so much necessarily strictly connected to schools. And then also counties have 3 days to implement any new adjustments to that. But I think what's important is how does this really impact us for schools? So there was this reopening school framework guideline that came out on July 17th. We had been waiting for that for quite some time to come out. It came out on the 17th. Again, those same framework, as you're looking at it, remains into effect. Just that tier 1 is really the same as the monitoring list that it wasn't in prior. That schools that are in this tier 1 are not permitted to reopen in person unless they're able to get to that waiver situation. LA County has definitely said they will not seek waivers until we're out of that monitoring list or off of tier 1. But this goes to something that's very interesting is there's now this new guidance for small cohorts and groups of children, and that focuses specifically on students with IEPs, English learners, and we'll talk more about what that really means for us. And then schools, again, are eligible for reopening for in-person once they're off of that tier 1. So what's interesting now is you go from the purple, and as soon as you get into the red and you're there for at least 14 days, then you can apply for a waiver. Now that's a district by district decision. At the original time when this first came out around a waiver, we chose the governing board chose not to pursue that list, but then LA County came out and trumped that and said, we're not going to even seek or consider waivers right now when we're on the monitoring list. So that's where LA County is still in that same situation as they were before. And then again, any potential reclosure, which is if you have case rates and you have so many incidents on a campus during a certain time period, they could close a classroom, they could then close a school. All of those, that same guidance actually still is in place, connected to that original framework from middle of July. So one of the things that we talked with our board last night about was around this small cohorts and groups of children, which the California Department of Health guidance came out on the 25th. And Stacy, as you mentioned, today just came out with new guidance from LA County as well. So what that looks like, its real purpose is to give the opportunity for in-person child supervision, targeted small group supports of kids, and facilitation of distance learning in small groups as well. And then they define 3 different things in this. So one is the cohort, first of all, which is a stable group, has to be 14 children or less, can have up to 2 adults in there. So this magic number is around 16 is what they're looking for. And this is really critical in childcare situations. If you have more adults, then you have to have less children. So that's the magic number is 16. And what they describe as a supervising adult is anyone who's assigned to one cohort of children, but does not physically interact with other cohorts. That's really critical. And then this includes childcare staff, certificated, classified staff that could be on a school setting as well. And then supervised care environments are environments where multiple children come from different families, but they're being supervised simultaneously by an adult. And then it gets into what that could look like on a school setting. So some FAQs that I thought were really important to pull out here, because this kind of alludes to, Stacy, one of your questions is like, okay, what does this really mean for in-person instruction? Does this really open it up for special education students to be like full-time engaged in teaching and learning? And that really is not the purpose of this. It really is to establish minimum parameters for targeted services, and we'll talk more around what that could potentially look like and where we are at as a district right now. And then what qualifies as specialized and targeted support services. So that's determined by us as an LEA. Our governing board gives us direction around where they want to move in this direction, and we'll talk more about what happened at our governing board meeting last night. But this could long-term include like occupational therapy services, speech services, behavioral services, things connected to an IEP, supports for English learners and those students as well. And again, which students can be served in cohorts during school closures. Again, this is an LEA decision. And again, we'll talk more around, this really calls out your English learners, your students with IEPs, your at-risk students, foster youth, McKinney-Vento, homeless students as well could be targeted groups that we could work with. So how many cohorts can be on a single school site? And this is very interesting too. They really call out and say you can't have more than 25% of your school's capacity on your campus at any one time. So if you had a school of 600 students, you couldn't have more than 150 students on your campus at any one time. So you think about even our AM/PM model that we were proposing, we wouldn't be able to do that because that would be more than 25% because that was going to be 50% of our kids at any one time. And then does this require a waiver, which was one of the things that we talked about earlier. And this particular small group work does not require a waiver, but it does require our board to take action to say, yeah, we're okay with some of this. And that's what I'm going to lead into here in a bit. So what does this mean for our students who receive student support services? It would allow us to have in-person assessments that would be administered by our student support services credentialed teachers or other service providers. And when we think about this, the assessment that's required to determine an eligibility or continued eligibility for special education that's mandated by the state and federal law. And these assessments include initial assessments, triennials, or reevaluation, which is really a big deal because obviously we put those on pause when we went out in March. And so we've got assessments that we're backlogged on, and then we're already starting the year having not put these necessarily in place yet in terms of in-person assessments. Then in terms of what does this mean for our English learner families, we talk about, if you're not aware of this, our new students into our system, we're required to give them an initial assessment through the English Language Proficiency Assessment of California, and that is mandated, and it's a one-on-one assessment. And you can imagine trying to administer an initial assessment to a student who does not speak English through a computer. Probably not the best way to go about doing that. So this is critical for us as well. And that initial assessment needs to be done. And there's been no waivers right now within the first 30 days of entry into a U.S. school. And again, the CD has not given any extension on that. And then so the action plan, if approved, would allow us to actually test these students, whether it's depending upon how many are at a school site. If you have a larger number, we could, we have a testing team that we would put together, allow us to spread kids out, test them in that multi-purpose room. If there's a smaller group of kids, you could set aside a classroom. They would come in with the testing team and be able to do that as well. We would create staggered appointments to do this. Obviously, all the PPE equipment would be in place to make sure that staff and students are protected in this situation. So for both special education and our EL students, this would be we would be able to do this. So the other thing to think about in the future for student support services, we're not really there yet, but this could include, as I talked about, OT, your adaptive PE, your speech, other nursing situations that we could test for, counseling, small group counseling or individual counseling could happen, behavioral support services. And one could really interpret this that it could even include specialized academic instruction. But again, you have to keep it into that, the number. So if you think about an SDC classroom, you might have 3 or 4 adults and there might be 12 kids in the classroom plus the teacher. Now you have too many. So how would you break that out and what would that look like? But that's something that we would probably consider down the road. So last night we had this discussion at our governing board meeting, and this is the recommendations and direction that came out from the governing board. So we've been given authorization to focus on in-person assessments for students with IEPs and with the LPAC, the English Learner Proficiency Assessment for California. That the site and student support services planning will take place for at least the next 10 days. Originally, what we had last night was we were literally, Stacy, waiting for guidance for LA County, and I got an email probably an hour and a half ago that says LA County's now opened this up. So now we can really officially begin to move forward with this, but not until September 14th. We need, again, the board asked that we provide clear communication on protocols for both the staff and families. There was our School Start Task Force. We put together a very comprehensive overview of what this would look like for both the hybrid, a blended learning model, and our Digital Learning Academy model. So we're looking to tweak that to be able to push that information out and have some pictures, some diagrams so that people can see what this is going to look like, from the PE equipment to the signage that's on campuses, the processes for checking in for an assessment. That will be included in this document that we'll share with families. And then again, our governing board has asked us to provide regular updates to them. So the timing wise, the nice thing is our next board meeting is on the 15th. So it'll be right about the time we'd be launching this, and we'd be able to share with our governing board how this is going. What I do like about this is when you think about big picture of any transition back, currently, we have childcare available on all of our 10 school sites, and we're monitoring how that is going. You start with the ability to sort of practice these protocols around social distancing, cleaning, sanitizing, checking families in, checking kids into the front office. It gives you a kind of a dry run in a much smaller setting. And then we can begin to think about what would be next steps. Maybe our next steps would be, okay, what we're ready to do for the service providers who are comfortable and our parents who are comfortable. Maybe we look at speech services, and maybe speech can be a next piece. And then we can phase this in over time. And then again, the goal is to start this on September 14th if we're ready. If we're not ready by then and sites are saying we need some more time, we're not going to rush this. There's no point to that. We want to get it right. We want to make sure that we have structures in place so we can launch this successfully. So great segue, Stacy, to asking that question. I'm going to stop sharing and open this up to see what kind of questions you have around what this looks like for students in our district. Anything that you can think of.
One question I have is regarding the medical services line. That is only pertaining to those with an IEP or seeking an IEP. That isn't the annual vision and hearing screenings that would apply to specific grade levels or by teacher referral or in that sort of situation.
It actually, as you look at it here, I'm going to pull to the specific language here. It does say medical service, including visual impairment, orthopedic. So it could be all for any children for that to be able to happen. So we've kind of talked about that, and I know our nurses have already looked at potentially pushing some things out so that to hopefully be in that in person, but this would allow that opportunity for some of those normal services to actually take place. Because it falls under student support services, and student support services isn't just for special education students. Great question. So I think, I'll just share from my perspective. I think it's a big deal for the in-person ability because it gives us an opportunity to probably get more valid results. That's one thing I think about for both our EL students and even our special education students. I know Kim Howe shared last night, she will be working with her service providers to make sure that they are comfortable, that their needs are met, because those are conversations we do need to have. We have some staff who automatically opted for the digital learning academies because whether it's health conditions or wherever they are at, maybe not even for themselves, but someone in their family or where their comfort level is. But now as we're having conversations about even this, there are some staff members maybe who are not comfortable. So we need to work through what that looks like. And then some families who won't be comfortable for the idea of bringing their child back in for an in-person assessment. So that's why we want to get this information out to families. We want to be able to show diagrams, pictures, information, and then we want to give our site administrators a chance to think through what rooms are they going to use, where are they going to hold this, and it's very situational from site to site because when you think about the LPAC, I think, Dee, if I'm not mistaken, Kate Petty said last night we have about 150 students that we would need to assess this initial assessment.
Approximately, yes.
Approximately. So, and that varies from site to site. And so, one of the things that I definitely communicated last night is we wouldn't be stacking assessments back to back. We would have time in between so that just like when we were building a plan for students to transition between a group of kids in the AM and a group of kids in the PM, we've done some dry runs around the hydrostatic sprayers and how long that takes to clean an entire room. We have wipes, we have gloves, we have all of the paper gowns, we have masks, we have shields with drapes, all of that. We have sneeze guards for the one-on-one assessment so that the child between the teacher and the student, there is plexiglass between them to ensure safety. All of those kind of things we do have in place, and this will now between last night and whenever we hopefully launch on the 14th, it'll give us time to assess, are we ready? And if we're not, again, we'll push that out and make adjustments accordingly. But we believe we can be ready on the 14th. Kim's going to work with our service providers. We'll be talking to our site administrators around creating the plans. Part of our reopening protocol is they have to have a safety team, the reopening protocol team, and that includes site administrators, office staff, custodians, safety soup, other people, teachers, to be able to make sure that they have feelers out there on their campus to ensure that the protocols are really in place and we're ready to go as we think about eventually at some point be given the opportunity to transition back fully.
I have a question, Mr. Pizzell.
Yeah.
My daughter is in SDC class at Valencia Valley with an IEP. So it's a little confusing, but I think what you're saying is that you're going to start first with assessments and then possibly move to some having on-site some services such as speech.
That is what could happen. Right now, we've just taken the step around the assessment piece, around the annuals, triennials, and that type of piece. That's what we're going to start with first. But this small cohort guidance does give a district the authority to do these in-person services once you're ready to make that move. We want to start first with the assessments and then eventually have considerations around, like you just talked about, speech, could be OT, could be adaptive PE. There's a lot of different things we can consider over time.
Okay, and so we should expect to hear from them how in the near future?
Yep.
Okay.
Yep. She's in fact already got a letter, I think, put together. We've reviewed, and there should be communication coming around so you as parents know what to expect around these different things. Great question.
Thank you.
Anything else? The only other thing that I did want to share out, and whatever word of mouth you can do too, is childcare. So, childcare is on all 10 school sites. It's a tiered system. So we're providing a subsidy for any family in Newhall School District. The normal cost for a full day that runs 7:30 to 5:30 would normally be $225. We're subsidizing $80 per family, no matter what income qualifications you have. If you are a family that qualifies for reduced lunch, it drops down to $25 for that week. So we're subsidizing basically $200. And then if you are a free lunch family, it drops all the way to $10. So we're subsidizing $215. And any family that is a McKinney-Vento family qualifies for homeless, we're subsidizing 100% of that. So if you know families that are in need or they're struggling with how to get their child online and they're figuring it out, please encourage them to reach out to their site administrator, reach out to the child care provider. We did budget. We set aside we're trying to serve up to 1,100 students in our district, and we're under 400 right now. So, and a large portion of this money is money that was set aside that has to be spent by December 31st. Now, we're looking at other things right now already. We're going to planning to put in an order for additional Chromebooks, because now's the time to get a hold of those and change them out for other things, because we're looking at now touchscreen Chromebooks and that kind of stuff with some of this money. But if you know of people who have needs, please have them reach out to their site. We're willing to work through and support families, because for me, this was just a big calling. I need our families to be able to go to work. And if they need to go to work and childcare is prohibitive, we need to solve that issue for them. So getting the word of mouth around that is really important. And I understand some people are not ready to do that, probably because they're feeling like if the schools aren't safe to open in for whatever reason right now, maybe I'm not ready to send my child back to childcare. But things seem to be going pretty well. Kids are connected. They're getting opportunities to interact with peers, socially distance, of course, and all of that. But they spend the morning focused in the academic realm in the classroom and making sure they're on for their meets and other things. And then in the afternoon, they're able to engage in different activities that are put on and sponsored by whichever childcare provider that is. I'm going to stop recording.